Hello friends, welcome to another session of question and answers for step 1. Today we're dealing with a patient who is a diabetic patient. She's also suffering from hypertension and renal insufficiency, and a bunch of lab values are given. And the question says we have to find what kind of drug is causing her these kind of lab values. So if we look at the lab values, the first thing that comes to my mind is that her pH is acidic. So what kind of drug causes acidic pH? That's one thing that we have to look for. Her bicarb is 14, which is low for her acidic pH, so which also says that her pH is not compensated. Her serum lactate is 7 millimoles per liter. From that we know that this lactate, the lab that's given in the test is actually in unit per liter. This is millimoles per liter. So if you look for this lactate value on the labs, you're not going to find it. But every time there is a lab value and you cannot find it in the lab values that's given in the exam, you have to automatically assume that it has importance, or the value is probably high. In this case, serum lactate is 7. We're going to think that the lactate is high. In the anion gap is 19, which is also high because the normal anion gap lies between 3 and 11 milliequals per liter. So we have this patient who is a diabetic hypertension suffering patient who has an acidic pH, and all the lab values is leading towards the fact that the acidic pH is probably due to increased lactate. Let me do a quick review of physiology and biochemistry. Where does lactate come from? Lactate comes from pyruvate. It's one of the 5 pathways pyruvate can go to. What are the other 4? Alanine. It can go so the second one is lactate. It can go into TCA, so it can form acetyl-CoA and enter TCA. And it also has other 2 which I can't remember right now. So point is, pyruvate is giving lactate, and whenever there is an increased lactate level, what kind of sense do you get from it? What does that mean to you when the lactate is shooting high? Having an increased lactate is very, very bad. It means that the body is doing what it should not be doing. That's anaerobic respiration. In this kind of scenarios, it's probably okay because she's probably taking a drug which is causing her lactate to go up. But for someone like a cancer patient, when the lactate is going up, that means the body's normal mechanism is shutting down. It's doing what it can do at that point, taking the short route to get as much energy to keep the body going. So lactate is something my mind should automatically, or your mind should automatically think about it, that the body is shutting down. So lactate is not, high lactate level is not something good to have. But in this case, the serum lactate is because of a drug, and the drug is, that's right, metformin. The most adverse effect of metformin is lactic acidosis, and it's all over the question. The fact that she's diabetic, the fact that her pH is acidic, her anion gaps, so all these are leading to the fact that she's having this problem for a little while, and it's showing up in terms of her blood pH and her lactate. So that's about it. So it's a good question. I think it's one of the reasonable questions that step 1 can ask, and you should be able to answer. Pretty much all they wanted to know is which of the diabetic drug produces lactic acidosis. That's how simple the question is. They just had to make it a little interesting with lots of details here and there, and also questioning you whether you can pick it up from a question which has a bunch of things given to you, kind of not in plain sight. So that's about it. See you in our next video, and until then, keep studying hard and keep going at it. Okay, bye for now.